How to protect yourself from COVID-19. COVID-19 is a respiratory disease caused by a strain of coronavirus, which is spreading quickly worldwide. It is particularly dangerous for the elderly, immunodeficient, and people with lung disease and other underlying chronic medical conditions. To protect yourself from COVID-19, wash your hands. Avoid touching your face and eyes. Wear protective gear. Use hand sanitizer if hand washing is not available. Avoid exposure. If you are sick, avoid exposing others. Clean and disinfect. And most important, don't panic. Wash your hands. Use soap and water and scrub for at least 20 seconds. Like you just used a single-ply teepee in a bathroom at a frat house and you're about to eat finger foods. Do this often, especially if you touch door handles. Avoid touching your face and eyes. Everything we touch has contaminants. Those contaminants come from hands, clothes, shoes, and even droplets in the air. Think to yourself, might a child have been here? If the answer is yes, wash your hands. Wear protective gear. Face masks are a good option, but are not as helpful as one might think. They are necessary for people who are sick, but do not necessarily protect you from getting sick. In fact, you're just as likely to get a virus from droplets in the air, which enter through your eyes, as well as your mouth and nose. Eyes, the windows to your soul, and an open door for germs. Wearing protective goggles or glasses provides better protection, and they're absolutely necessary if you are caring for someone who is sick. Remember to also wash your protective gear with soap and water and throw masks away after each use. Then wash your hands again for good measure. Use hand sanitizer. The CDC recommends at least 60% alcohol content. Keep in mind that while hand sanitizer can kill coronavirus, it is not as effective as washing your hands with soap and water. Use it only as a last resort. Avoid exposure. Coronavirus can be transmitted through tiny droplets in the air to your eyes, nose, and mouth, or by contact from hands to your face after touching infected surfaces. Therefore, the safest place to be during an outbreak is at home. Avoid unnecessary crowds, public spaces, and parks. Keep in mind that if you are an unknowing carrier during the incubation, you could infect others in these spaces, which could result in fatalities. Being bored is not enough reason to go out. You will kill somebody's grandparent. Binge some shows, catch up on reading, or use this time to call your mom. She would love that. If you're sick, avoid exposing others. It is extremely important to take care if you must leave your home. If you know you are sick, you should wear a mask and only go to your doctor or the ER. Avoid breathing or coughing in such a way that droplets could land on surfaces. Cover coughs, preferably with a tight mask, but never with your hands. Into your elbow or a rag will work in a pinch, but be mindful that your clothes are now contagious. Coughing in the vicinity of others will put them at risk, making you a potential target for unbridled rage. Clean and disinfect. Public surfaces are susceptible to exposure, particularly where human interaction occurs. This includes tabletops, doorknobs, countertops, handles, phones, keyboards, toilets, faucets, sinks, places where people can grab or rest their hands or arms, and that may receive perspiration. Remember that droplets travel through the air, so even a covered cough could coat large areas with tiny droplets of infection. EPA-approved household cleaners including bleach, Lysol, hydrogen peroxide, and a 70% or more alcohol-based cleaner are recommended for sanitizing against the virus. Remember, do not mix cleaners. We're trying to avoid dying. And don't panic. Although COVID-19 is deadly for many people and is spreading rapidly, the preventative measures needed to protect yourself are the same basic practices that you should take to avoid any other infection, including the flu. It is important that we take these steps in order to prevent the potential reach of this virus. If we take this seriously, we can slow the spread and prevent needless deaths from hospitals being over capacity. Stay home. Wash your hands. You got this.